Hi, Dr. Edgar here from Edgar Family Chiropractic, and I'm here to talk about one of the most common things we see in the clinic, and that's low back, but a disc injury from the low back. So a disc injury can really happen to anybody. It can happen to people who are not that active and they sit a lot and they're putting a lot of compression on their discs in their low back. But it can also happen to people who are very active and lifting a lot, whether it's at the gym working out with improper form or even just kind of day-to-day stuff. A lot of times it can happen from a singular event where something happens and they feel something like pop or give out during a lift. But it can also kind of happen over time gradually, where the disc just kind of wears down over time and slowly it loses its integrity and starts to give way. So some of the things that can happen from disc, it can range from just like a small disc, which is what we would call like a disc bulge, where it's just kind of protruding out to the side a little bit. Other things can happen where the disc can actually push all the way through, as we can see here on these models. And what it ends up doing is it actually puts pressure on the nerve. So this is what people will feel when they come in with disc injuries, is they will generally have some type of low back pain, but accompanied with that, they will usually have either one or sometimes two pain in their leg coming down into their thigh, into their buttock, sometimes all the way into their calf. They can have things like numbness, weakness, burning pain. These are the type of things we generally see when people are having disc injuries. So some of the ways that we treat these disc injuries, what we're trying to do is we're really trying to take the pressure off that disc to allow it to kind of heal and go back to where it came from. So things like manual traction, mobilizing the spine and the joints, loosening the muscles. And we're also able to do some of the therapies that we have here to help manage the pain and the inflammation that comes with it. Things like ultrasound, stimulation, acupuncture, and then also giving people some homework that they can do at home to try to relieve the pressure in the back and on that disc.